Hi friends, I am Joel John J from Joel John J YouTube channel, and this video is about rabies vaccination. Do you have pets? Then you must be vaccinated for rabies. Or are you in a place where you have stray dogs, that is dogs roaming on your street? Then better vaccinate for rabies. It's a vaccination, so you can do it even without a bite. So who all can do it? Anybody who come across with the dogs, cats, bats, and all those. But are there some special category of people who are more prone to these kinds of things? Yes, we do have. They are like pre. This vaccine is called as pre-exposure vaccination. After bite, also you have to undergo some vaccination, and also you have to undergo some immune injections. The immune injections will be in addition if you get a bite and then go for rabies vaccination. So why rabies vaccination is essential? What the rabies means is it's known as a fear of water disease, that's hydrophobia disease, which is transmitted by a virus, and this virus is deadly, that is this is fatal. That is most of these people, when they find out the symptoms that you are affected by rabies, that is if you don't go immediately after getting a bite and get the treatment, the chances of preventing saving your life is negligible. I cannot say that no one has survived, because there are few people who have survived by taking the treatment after finding out the symptoms of rabies, but most probably they die. So better get vaccinated before, and once you get bitten by any animal, immediately visit a doctor and also follow some precaution measures, like wash that area with running water with soap or detergent, or with spirit, that is alcohol, not the drinking alcohol, the alcohol which is called a spirit, which is sold on medical shops for applying, or with iodine tincture. And after washing, clean the area with cotton and then apply iodine tincture, or spirit, that is 70% alcohol solution, which is used for cleaning the wounds. So that is the first aid you have to give, and then immediately you have to visit the doctor and get injected against for the bite which you have undergone. This is not for snake bite and all. For that, based on the animal, you will be given treatment, but for any bite, go to the doctor immediately. Okay, now when talking about this pre-vaccination, it's a preventive measure. Why we do that? Because rabies virus cause when symptoms are known, mostly the person dies in spite of getting the treatment. So who are all at more need this pre-exposure vaccination? Highly recommended for veterinarians, that is veterinary doctor, and veterinary college students, animal keepers, that is if you have a pet, you are animal keeper, irrespective whether it's a dog, cat, or a monkey. So when you fishes are different, but still and hunters, now hunting is 100% prohibited in India. Mostly all most of the nations have prohibited hunting. Forestry workers, those who work on forest areas, animal handlers, that's those who transport animals, goats, cows, those animals are also included. Butchers, that is people who cut the animals, cut the meat sellers. Okay, so now we are going to look at the list of animals and how it spreads. Rabies mainly spreads with the saliva of the infected animal. Okay, that's how it spreads, but in rare cases there are also chance for spreading when the meat is not cooked properly, as well as during organ transplantation and tissue transmission. Rabies virus infection may spread. So it's very essential that you cook your food properly before you eat. Okay, that's an important thing which you have to do. Don't eat raw meat. That's mainly raw meat. Okay, so what are all the animals in pets and farm animals also spread the rabies? Cow, I will read the names: cats, cows, dogs, fitters, goats, and horses. Okay, so you may think that you are only going goat or cow for milk or for eating, but they also have the chance of transmitting rabies from their saliva. So you have to be when how this spreads is just if the saliva comes in contact with the intact skin, that is in the skin which has no wounds, it won't get infected. But If it goes into your mouth, eyes, ears, you will get infected. Also, you may touch it and accidentally you may place it on your mouth or eyes. Mostly you place it on your eyes or ears. That's where the people do have some itching feeling, right? So that's also a chance to spread rabies. And this is also with wild animals: bats, beavers, coyotes, fox, monkeys, raccoons, skunks, and wood skunks. These are the most likely animals, but not that these are the only animals. Some other animals may got bitten by these and got rabies, and they also may spread. So these are the common animals. This rabies is main targets your central nervous system and your spinal cord and brain. So it affects the main part of the brain, and it has a lot of symptoms. And before getting into the symptoms, the normally why this spreads is it spreads on 5 phases. And why we I say vaccination is very important is normally the symptoms appears in 3 weeks or 12 weeks, that is 21 days or 84 days. But there are cases in which even after within 5 days you will see the symptoms. That is very good, you can get treatment easily. And also there are cases wherein you see the symptoms only after 2 years. And also the spreading rate is important. Okay, so what a vaccine does is it's a sample virus which teaches your immune system to fight against the new virus, which is foreign virus, which is not known much to you human beings. So you don't have your immune system trained to work against them. It's just like giving training to soldiers, training your immune system. Okay, so like what are all the symptoms which a person undergoes when they come across this kind of viruses? Will have aches and pains, saliva oozing out from the mouth, unable to get up from the bed, cerebral dysfunction, that is your brain doesn't function properly. That's why you will get the anxiety. Anxiety is you feel tension, right? Tension, confusion, you don't have a clear thinking, agitation, you agitate on things, and you get angry. And also you see things like hallucination is you see feel that you see something but that thing won't be there. You will be seeing something but that object won't be there anywhere. Imagination, they say, right? Imagine you will be living in an imaginary world. That's one effect of this virus, because it affects your brain and central nervous system. So it creates these kinds of disorders in a person. Okay, in Tamil they call it as maya totram. Okay, and tingling at the wounded site on the place where you got the bite, you will have some itching feeling. Okay, insomnia, you won't be able to sleep. And which is this is a common sleep disorder. Okay, so you get this insomnia disease. So when what they call it as people, because of the superstitious belief, they will think about some demon attack and some evil spirit attack on them, and they will be doing some other following some religious things. Follow if you are comfortable, if it gives comfort to your mind, you can follow. There is also a field of medicine where you call it a psychiatrist. You should meet a psychiatrist who has done his MBBS and MD in psychology. I am not a psychiatrist, I am not a medical doctor. I have pets. I will talk about my pets later. Because my Duber used to bite me often, that's why I got this rabies vaccine, and I am now immune to rabies. I got this vaccination for 5 days, 5 times. It will be like so few days later. Okay, and also they will put one injection. I will come to that story later. And prolonged salivation, that is saliva will be using. Our respiratory problem will be their heart deterioration, that we call it as the heart's main pump, the ventricles will become stiff and they will not fill properly or fully. So that during when the heart beats, so that creates a heart disorder. Okay, and finally it will take you to coma and then you will die. So it's a deadly disease. So now I will go step by step how all the stages in which this spreads. But before that, I got vaccinated because my Duber, Duber, right? Those who usually watch my videos will know about Duber. He bite here and 2 holes and a little bit of blood came out. And his behavior was, he usually behaves like that, but his behavior was very odd. Even today his behavior was very odd. He's a ferocious cat. He will usually beat, bite and scare, and he will kill all the kittens of other cats. So he's a very ferocious cat I have. I think he will be more than 2 years old, even if he's infected by rabies. But mostly rabies infected animals die on 10 within 10 days, and human beings die within 14 days. But don't follow the old traditional method of catching the stray dog which bites you. If it's a home dog, you can inquire to them about the dog's health. That's okay, but that will again create a whole huge tumor for you. You can don't try to catch the dog running behind the dog. Oh, it has bitten me. I have to tie it and guard it for 14 days and see, or 10 days, and see whether it dies or not. I have to see whether I have got affected by virus. The reason is, when you go beyond the dog will bite you more. And when you try to catch the dog will bite you on your hands. Usually it will bite on your legs or somewhere. That more the distance of the bite location from the brain, the longer the time it takes to affect the brain. Shorter the distance, soon it will affect your brain. That's when the rabies become deadly. Okay. So also in snake bite, don't run behind the snake. If you have a camera, if you can take a photo, take that. And if you are at a safer distance and the snake is not trying to bite you again, otherwise don't go beyond the snake. Don't get frustrated. Don't become panic, and don't run to the hospital. Get a auto or taxi, or ask someone else to accompany and take you safely to the hospital. That is very important. When you become panic, your blood starts beating high and your poison will spread. So always when animal bite or any bad situation, handle it cool and calm. That's when you are at a more safer zone. So because of my Duber bite, I went and took the rabies vaccination. And they said cats also should be vaccinated, but I am unable to find a veterinary doctor who will come and apply vaccine to my Duber. And catching him for putting a vaccination is more terrific. He won't let anyone to catch. So that's the kind of situation I am in. If you know any solution, comment on the comment box to me. I am at Thuthukudi, and Duber is at Thuthukudi only. He won't come to Chennai and all. So I am at a situation where I cannot catch him and take him anywhere. He used to pet with me, but when someone else comes, he will get very angry and become ferocious. So it's very hard to get him vaccinated, because I am much afraid in case if he gets affected by rabies, he will die. What I will do for my Duber, my pet cat. Okay, now getting back into the topic, it spreads on 5 stages. The infection. First is incubation. The time when symptoms appears is which takes about 3 to 12 days. The 12 weeks, sorry, 3 to 12 weeks. That's 21 to 84 days. Almost all the times this is the case. This is the case, and sometimes that happens in 5 days itself, and or 2 years. Now, as already I told you, right, closer the bite to the brain, sooner it shows the symptoms. Also, the sooner the infection goes to the brain. So, don't go beyond the animal, chase the animal and try to catch it, and safeguard it for more days. And in the meantime, it may also someone else in your home may come in contact with it, and they also will get bitten by that and infected by rabies. So, just visit a doctor. Just try to take a photo of the animal. If it's an some other different animal, dog, anyway, you'll be knowing dog or else. If you take a selfie and after getting vaccinated and everything, you can roam around the street and find out who is the owner of this dog and check him whether it's healthy or something. Okay. Also advise them to get vaccinated, and this government, the municipal and corporation bodies, they remove these stray dogs, that is the dogs which are roaming on the streets without any proper habitats. That will itself reduce the spread of rabies. And another one is prodrome. Prodrome is the second stage. That is, you will get symptoms like fever, which will be about 38 degrees Celsius or above, and headache, cough, and dry throat infections. These are the very initial symptoms. And the third symptom is where they get more of the psychological symptoms. That is like confusion, aggression, grid neck musculars. That is another one thing is like involuntary muscle twitching, partial paralysis. That is, you won't be able to move your hands or legs at sometimes, and irregular movement on body. Suddenly your body will be moving without that is called as, in Tamil they will call it as valipu. Fits in English commonly, this disease is known as fits. They will say that he got fits and hands and legs will be shivering, and they have a old traditional method of getting some iron things and giving it on their hands. And also in some films they will show the person will act like he is getting fixed and get that main person whose house he planned to rob, and that someone will ask for the keychain and give it to him, and he will keep it on the soap and take the key impression and all. In cinemas you will be able to see that kind of things. So that is the Fitz disease. This may come because of rabies infection. Okay, so if you have pet, get vaccinated. And hyperventilation is a case wherein in your body the acidity levels will decrease and salinity will increase. What this resultant effect will be, there will be an increase in breathing. They will say it as மூச்சு வாங்குது இல்லையா, people will take breathe like that, right? That is called as hyperventilation. So that the chemical reason behind that is, I am a chemistry graduate. So chemical reason behind that is decreasing acidity and increasing alkalinity, that leads to abnormal increase in breathing. So everything is determined by chemistry. So chemistry is a very important subject. And then hypersalivation or producing a fourth, when cobra and another one viper, kite, they used to call it as kattuviriyan in Tamil. These two are neurotoxic snakes, which accounts for the most of the deaths in India. And this kite bite is often accounted with cobra, and also even king cobra bite is accounted with cobra, because for both you will have froth coming out of the body. For king cobra, in some cases the body will turn into light blue because of the higher dosage of venom injected. And when this kite is the third most toxic venom holding snake in the world. India has that privilege and of having that in my plenty. And we have the cobra snakes, which accounts for most of the death, which is because it's very commonly found on land. And this kite usually used to come and sleep with people for warmth during night. At that time, if you touch it, it will bite you. And also it gives painless bite. It will be like a mosquito bite. So people don't even get up from their sleep, and they die with froth on their mouth. So if such a death happens, it's not cobra bite. Cobra gives painful bite. King cobra gives very painful bite. So those bites you will wake up. But in dark, if king cobra bites and when fourth comes, people say it's a cobra bite, because they don't even take the person to the doctor. On the remote places, medical facilities, there are, even after a highly civilized world, there are places where there are no medical facility, and all the bodies are not being suspicious death bodies are not being done postmortem before the death, before burying. So those kinds of things are there. So I thought of explaining about the fourth, because why fourth is coming for this rabies as well, because it affects the central nervous system. Anything which affects the central nervous system will lead to fourth on the mouth. When those who are having fits, that's Tamil, it's called valipu, that is hyper that is convulsion. Valipu is called convulsion or fits. So that also affects, that's the central nervous disease. So that's why fourth is coming out from the mouth. And then hydrophobia, that I already told you, the rabies is called as a fear of water disease. Because of the feeling they have on the throat, they will even avoid to drink water. And other things like hallucination, maya totram. You will see objects which are not in front of you. You will think of something and get feared. You will feel something. Nobody would be touching you. You will feel something like someone is touching you, someone is brushing you, all those things. Okay, difficulty in swallowing, nightmares. That is harsh, terrific dreams. They are called as nightmares. Dreams are nothing but your mind will be recalling something which you seen earlier, or something when you fail on sleep. Those are dreams. It's a natural phenomenon. Every person will get dreams. And sleep paralysis is something, a state like coma, but it's not a medical disorder and all, physical disorder and all. You won't be able to move your legs, but your mind alone will be awake. So at that time, you will see that someone has tied me. They used to say, they have tied me with evil spirits, brother, and I am unable to get up from my bed, and the evil spirit that did that to me, this to me, all are called as sleep paralysis. I came to know about this from the YouTube Tamil superstar Mr. Madan Gauri, from one of his video. Okay, so other things like insomnia, that's a sleep disorder. Everything is happening because this virus is affected your brain. So it's a psychological problem. You have to meet a doctor, MBBS, MD, psychology doctor you have to meet. Okay, if you get it without dog bite, if you get dog bite, meet the doctor and get the vaccination first. And insomnia, peripism or permanent erection in males, phytophobia or fear of photophobia or fear of light. If they see the light itself, they will get fear. Towards the end of this phase, breathing becomes rapid and inconsistent, and finally it will take you to coma. Once you are taken to coma level, and then chances of person recovering from coma is very less. But there are cases where people have recovered, so immediately get medical attention. And in India, you have a very good chain of government hospitals. If you are wealthy enough, you can go for private hospitals as well. And if there are very few private hospitals will take in rabies affected people because of the fear or lack of facilities to treat this kind of rare diseases. Check for medical treatment. There are cases that the person may come back live, and also death happens when people are not supported with the artificial when breathing system, that's called as attached with ventilators. That's artificial breathing system. Within 4 hours of coming to coma, mostly it leads to death. So be very careful. Admit the person in hospital once the rabies symptoms becomes high itself. So now, what are the common tests they use to test saliva, blood samples, spinal fluid, and skin samples as well? And treatment, as I told you already, you can only give the first aid. There is about some 5 doses of vaccine which you have to put for vaccine, and get vaccinated first itself, so that you get a very less chance of getting affected by rabies. Even if you get bitten by after getting the vaccination, visit the doctor, because there is an annual booster dose which you have to take after the vaccination. As I see on this vaccine bottle, take that as well. You may fail to take that, but so have your vaccinated details recorded. And in all the hospital, they will now they are maintaining patient records. This vaccine is produced by Serum Institute in India. After COVID, Serum Institute has become very popular. So you have all the facilities in the country. So get to them to the hospital and treat them properly. And whenever you get a bite, whenever you get a wound, even for any bite, wash it thoroughly with running water, not and don't force it on the wound like this. Make sure that the water goes out, and then put some soap water and wash it, and have some sponge and some handle stick or something, and push it like this, and then have some cotton and clean the wound well, and wash with at least for 15 minutes, they are saying. If you are on a very remote place, and if you have time, if you are being on the process of taking the hospital, just pour water, have some water and pour it whenever you go, and clean the wound with the cotton. Just keep apply on it and take out the cotton, don't push it inside the wound. And then after that, with tincture, apply tincture on the area, or 70% alcohol, that is sprit on the medical store. Don't take this liquor alcohol and pour it there. Okay. And then take them to the doctors are well trained enough. Even if you are sure that you are bitten by a poisonous snake, they will check for whether it's a dry bite or a poisonous bite, because there is also a dry bite. So cobras also give dry bites at times. That is, they won't inject the poison inside, and poison won't get affected. At that time, they won't even give you anti-venom, because the anti-venom even have some kind of side effects. And for that, you will have to be on hospital for about 7 weeks. They will keep you in isolation, and they will check for the symptoms, like as eyelid is closing automatically and all those. For snake bite, I'm saying, then only they give the treatment. So very first thing is, give the first aid, that is wash the wound, put clean it with a clean it, that's keep and take, dry it with the cotton, then pour some sprit, that is 70% alcohol sold on medical store, or ginger, then take them to the hospital. Okay, this is the first aid. And press the thumbs up below. And also, I have got YouTube related videos. Now I am putting you how to create YouTube channel, what are all the things available on YouTube channel, everything I am putting on videos, and lots more coming up, so that you will understand the YouTube media which you used to view videos and use it full for the fullest. Those videos will be coming up and coming continuously. So after pressing the subscribe icon, also ensure you press the bell icon, and you get the new updates. Apart from these kind of useful videos, I will post whenever I come across some scenarios like this. And also share some comments, type something on the comment box. Everything you can do only if you log into this YouTube with your Gmail ID. Don't hesitate to log in. When you start logging and start watching, wherever you go and whichever system you sit and log in with your Gmail ID, the home screen videos will be based on your interest. The YouTube algorithm will understand you and give you videos. That's the biggest advantage of logging in with the Gmail ID that's on the sign in button, and watching YouTube. Okay, friends, it's time to say bye. Share this video with your friends and ask them. Also, if you don't even miss out to ask share this video, whenever you see your friend or anybody, ask them, are you vaccinated against rabies? Do you have pets? or there are street dogs in your street, or you have monkeys, or you are coming in contact with animals? If the answer is yes, ask them to vaccinate. If they question more, give this video and ask them to watch this video fully. Then only they will understand the seriousness why rabies vaccination is mandatory. And when you go to hospital and ask for rabies vaccination, tell them this is a pre-exposure vaccination I want to get in, and this one dose cost about some 360 rupees, I think. Apart from that, you will get the hospital charges for injecting the injection, and visiting the doctor. I think visiting the doctor one time is enough. They will just check your blood pressure, and doctor will ask some questions. After that, you can they will ask you to directly come to the nurse, and resting procedures will be done by the nurses itself. At that time, they charge only lesser amount, because for consulting with the doctor it will cost more. So this times, I think 5 times will come about somewhere around 1800 rupees. Totally itself it will cost you about some 2000 or 2500 rupees. But it cost this cost is much lesser than the value of your life. Well, the reason why again I am repeating, this is a deadly fatal disease, and everyone who comes in contact with animal has a risk of getting infected by this disease. And this disease shows symptom at a later stage. When symptoms is shown itself, it's very hard to treat and bring the person back to life. So if you get bitten, and if you are getting some symptoms, even if you get a fever, tell the doctor that you get a dog bite or a cat bite, or anything in a short span of time, so that the doctor will recommend you for vaccination. Or before that itself, you get vaccinated and one annual booster dose. They will be on a safer zone. And even if you get these things after getting bited, there is something called immuno injection which you have to inject as you got the bite, as you are being bitten now. So ensure that even if you are vaccinated, if you get a bite, you have to visit the doctor. If anything confuses to you, share this video and ask the person to watch fully. It's time to say bye, and so Joel John J signing off from you. Bye.